Hi guys, I'm Professor Linton and I'm going to be showing you guys how to do a comprehensive assessment of the newborn. So once baby is born, we always want to section the baby starting with the mouth, and we're going to do side to side, excrete those secretions, and continue to do it until all the secretions are out of the mouth. And then we're also going to get the base of the nostrils. So with the bulb syringe, we do mouth and nose first. We're going to get some vital signs on our baby now. We always do a temperature axillary. We're going to put it under our baby's arm and hold our baby's arm steady while we get our reading. After getting a temperature on your baby, you want to get the rest of your vital signs. We'll be getting a heart rate and a respiratory rate. I'm going to go ahead and use the bell of my stethoscope. If you have a normal adult stethoscope, I recommend you use the bell side of it just to hear and listen to a better reading, okay? I'm going to start with my respiratory sounds. When getting a respiratory rate, you do want to listen for 1 full minute. You always want to check the anterior and posterior side of your baby. I'm going to turn my baby over, listening to that posterior side. Here I am going to listen to the heart rate. For recording purposes, it is shorter, but I also recommend and instruct you to listen to your baby's heart rate for at least 1 full minute to determine if there is any abnormalities. We're going to get a head circumference of the baby's head. You're going to place the measuring tape snugly around the widest part of the head, starting just above the eyebrows and ears, wrapping around to the most prominent bump on the back, which is the occiput. For the chest circumference, you're going to place the measuring tape snugly but not tightly around the chest, passing directly over the nipple line in the front and across the scapula in the back, ensuring that the tape is level and snug under the armpits. For the abdominal circumference, you're going to put the measuring tape around the abdomen just above the level of the umbilicus, ensuring it is snug but not too tight and perpendicular to the spine while the baby is lying on their back. Starting with our head-to-toe assessment, we're going to go ahead and check the fontanelles on the baby's head. Your baby has anterior and posterior fontanelles. This determines the soft spot of the baby to determine if it's soft and flat. We are also checking to see the baby's suture lines. Are they separated from each other, approximated from each other, or are they overriding? And this just could depend on the baby's anatomy and also the type of birth that they have. When checking the baby's face, we're going to make sure the eyes and ears are symmetrical, looking for any abnormalities, making sure there's no drainage in the eyes. We're checking the nares of the baby's nose to make sure that each one is patent. We're looking in the baby's mouth with a gloved hand to detect if it's pink and moist. Does the baby have any signs of cleft lip or cleft palate? Is the palate intact? Does the baby have a good suck reflex, a good rooting reflex? Then we're going to come down to the clavicles, making sure they are both intact. There's no signs of any fractures, okay? Coming down to the baby's torso to see if the nipples are intact. There's no skin tags. We also are generally in its entirety checking the baby's skin to make sure it's normal to ethnicity. I'm also going to check the baby's brachial pulses to make sure they are both palpable, so you always want to make sure you're checking both sides. Coming down to the hands, I'm doing the palmar grass reflex and checking the fingers, making sure there's 5 fingers on each extremity. Okay, I'm also going to go ahead and lift my baby up a little bit to check the baby's tone. Does the baby have normal tone, or does the baby seem a little bit weak and flaccid? Okay, coming down to my baby's abdomen, I'm looking at the cord. Does it have 3 vessels? Does it have 2? Does my baby's abdomen look soft and non-tender, or does it look rigid and firm? Okay, removing the diaper, we're also going to check the femoral pulses. We're going to check both sides, checking to make sure they're both palpable and within normal. Okay, I'm also going to be lifting up my baby's legs to do a hip click check. Okay, this is very common in babies that are born breech, which means they're born feet first. So I always do one hip and then I do the other and then I compare them both. And you want to make sure that there is no abnormal click happening. Okay, coming down to the baby's feet, continuing to look at the skin color, checking the Babinski reflex, the plantar grass reflex, bringing my baby's legs up, checking the genital area depending on if they're male and female. Does everything look within normal? Putting the diaper back on, making sure the diaper's back on because babies like to have accidents. Okay, I'm going to go ahead and my cord is there. Cord should always be on top of the diaper to prevent it from getting stuck. I'm going to bring my baby to the side with good support, run my finger down the baby's back, making sure it's straight and intact, bringing the diaper down, checking the sacrum, is there any abnormalities, checking the skin. Sometimes a lot of babies have Mongolian spots.